Good evening, and thank you for having me today. My name is Alyssa Mendel, and I'm the Research Project Manager for the CoRDS Registry at SANFORD Research. This evening, I'm going to share a little bit about the CoRDS Registry and a little bit more about SANFORD for those of you that aren't familiar. So Sanford Health is located here in Sioux Falls, South Dakota. So we're here in the United States. Sanford Health is a healthcare organization. As you can see here, we cover quite a large span here in the Midwest. We've got hospitals up in North Dakota, South Dakota, Minnesota, and then clinics scattered throughout the Midwest. And you'll see there our footprint is about the size of Texas. So a very large footprint that we have. Sanford Health has been around for over 100 years now. So the healthcare system is very well established. Here's some more information too about Sanford Health. You'll see we do have clinics scattered out throughout the world as well. So we do have an international presence. And then at Sanford Health, there is a division called Sanford Research. So Sanford Research is a branch of Sanford Health, and that's where I work, is in this building that you see here on the screen. And with Sanford Research, there is the CoRDS Registry, and that's where the program that I work for is located. Sanford Research has a few different initiatives. One of them is in pediatrics and rare diseases. And again, that's where the CoRDS registry lives under. So if you're not familiar with what a registry is, I'll share a little bit more about that today. I know it can be kind of confusing and it can be a new concept for some people. So we try to use a patient-centered approach. So we understand that in rare diseases or rare conditions, the patients, the caregivers, you tend to be the experts in the condition because some of these rare diseases, there's just not much known, and even sometimes medical professionals aren't aware of the ins and outs to some of these conditions. So in order to properly investigate a disease, researchers do need to have a full understanding of the natural history of a condition. So out of these two ideas, Sanford Health has sponsored the development of the registry. So again, what is a registry? I'll be talking a little bit about that today. So a registry can be, a collection of data captured regarding a group of patients. This can include, demographic information, health information, quality of life information. It can be patient or clinician entered. It really depends on the type of registry. And a registry serves as a way to contact members of a group later on. So think about if there becomes a clinical trial available for your type of condition, CoRDS is able to contact you and let you know about it. Or it can also simultaneously serve to build up the story of the progression of a disease. And that's where that natural history component comes in, where that helps researchers to know what is going on. So what is CoRDS? So CoRDS is a patient registry for all rare diseases and conditions. So we are disease and condition agnostic. We also take information on carriers of these rare conditions and the undiagnosed. And so we tie together patients and advocacy groups such as Alstrom United Kingdom and also researchers. So unlike other registries, Sanford Health sponsors CoRDS. We are made available at no cost. So there's no cost to patients, there's no cost to advocacy groups, and there's no cost to researchers. We are free, and we plan on always being free. So patients and families can complete a questionnaire. So CoRDS has worked very closely with Alstrom UK to create a great questionnaire that asks specifics about Alstrom disease or Alstrom syndrome. So in this questionnaire, there's going to be some very detailed questions asking about this condition. This again helps researchers to understand what is going on with this condition. So participants can enroll by completing their questionnaires and keeping their record updated. Researchers and clinicians can go on and apply for access to the de-identifiable data from the questionnaires that participants complete. So here is a quick snapshot of what CoRDS some metrics for CoRDS. So you'll see there's 86 different advocacy groups we have partnered with. We've got over 13,000 some participants in the registry, and you'll see we have a very large international presence with over 70 some different countries that we represent. So the majority of rare diseases do not have a registry, and many disease cohorts don't even have a community yet. And so CoRDS helps connect patients' natural history study with researchers and clinicians. A big question that we get often is who owns the data? So participants, they are the primary owners of the data because they get to control how the data is ultimately used. You can share whether or not you want, or you can give permission to share your data with an advocacy group if you would like. You certainly don't have to, though. You also have the ability as a participant to let CoRDS know if you want to remove all of your data. If that's the case, then we will take everything out of the database and there won't be any history of you ever enrolling in CoRDS. It's a fairly easy process if you were to ever want to remove your data. So CoRDS does store and manage the information, and this is required by the SANFORD Research Institutional Review Board. So the Institutional Review Board here in the United States is what governs whether or not research or a clinical trial can even start. So CoRDS is an IRB approved study, which also is very beneficial for when researchers want to come and look through data, just knowing that the data was collected in or through an IRB. So CoRDS will never sell, excuse me, CoRDS will never sell, rent, or lease personal information. Information in CoRDS remains there, again, unless a participant would like it removed, as I was saying earlier. Data can be used, researchers, they can petition to use the data or the de-identified data, so can pharmaceutical companies. And then again, patient advocacy groups, they're able to also view the data from participants who give permission for them to use the data. New discoveries are made based on the information contained in the natural history of the disease. And so, as I was saying earlier, oftentimes patients and caregivers, you're the ones who know your story the best, and you own your story. So by sharing your story, scientists and doctors, they do learn more about how to approach rare disease research and even hopefully finding some treatments. So here is a snapshot of how many people are currently enrolled in CoRDS who have Alström syndrome. You'll see there's about 52 people. This is the ages of people who are enrolled in the database. You can see there's kind of in the pie chart the different categories. And this is something that you would see too if you enrolled in CoRDS with your account that you would have. You would be able to view some of these demographics in the portal. This also shows how many males and females have completed this question. And so by now you might be wondering, how can you enroll? So I'll make sure to send the link to Catherine so she can share it with you. But it's a really easy process. So once you click that link, there's some basic information that we're going to ask you to have in order to create your account. Of course, if you don't want to do it online, you can do it through postal mail, and we can mail you a questionnaire and we can do all of that data entry for you. Or on the flip side, we can also email you a questionnaire too, and you can email it back to us. This will be the screen that you would see once you complete that activation form and create an account if you chose online. Right here under the rare disease diagnosis, this would say Alström syndrome, and then you would just proceed through the screens that it takes you through. And once you are enrolled, you should receive this thank you screen, but you won't see this thank you screen until you complete the Alström syndrome UK questionnaire. And then this is the home screen that you would see in your portal. So here, as I was showing you earlier, there's the view of the graphs that you're able to look at. You can also come over here to see the history of all of the times you have completed completed a questionnaire, because remember, in order to really help researchers get a good idea of what's going on, you should be coming into the registry, year after year, even maybe month after month if symptoms are changing. That's helpful information to show the progression of the condition. There's also the ability to upload any documents if you want to upload any genetic reports or any other information that you feel would be important to share. So wrapping up here this evening, CoRDS is 100% free of charge for all participants. Information from the CoRDS registry enables scientists to steer their research in the direction of discoveries. Patients, advocacy groups, and researchers are all brought to one location to combine their strengths. And again, please remember, CoRDS costs nothing but the time it takes to complete that questionnaire. And I should say too, you don't have to complete your questionnaire in one sitting. You can maybe answer a couple questions and then come back in the next day and answer a couple more. It'll just take you right where you left off. And if you have time, please feel free to check out our podcast. We host different researchers and advocates each month that talk about their rare disease journey and just share other helpful information. If you do have any questions, you can always reach out to me, or you can reach out to CoRDS. Our email address is cords@sanfordhealth.org. We're more than happy to help walk you through the questionnaire if you need help completing it or just even setting up an account. We're always here to help. I thank you again for listening to more about CoRDS and learning about Sanford Health.